Hello everybody. How's everyone doing today? I'm gonna give it a few seconds until we get a few more people before we get started here. Where is everyone from here? Anyone from California? Hello. Subject, I'm going to talk about a few things today. We'll talk about neck, middle, lower back pain. Try to go over some stretches, some exercises if you have some time, and I'll try to answer some questions. Spine, yeah, we're going to talk about the spine too. I'm going to start off talking about the spine, and then I'll try to go over some stretches, exercises, and then if you have time, I'll try to answer some questions. I get lower back pain. I'll talk about lower back pain today. I want to do some back stretches. I'm going to go over some stretches as well. Okay, so let's go ahead and get started here, guys. I want to give you guys a kind of overview of the spine first, talk about the curvatures and all, and then we'll jump into some stretches, exercises. So this is the spine, guys. This is what the spine looks like. If you're facing this way, we got the head here, we got the neck, the middle back, the lower back. If you guys could see, the neck goes in, middle back comes out, lower back goes in. The neck and the lower back have the same curvature. It's called the lordotic curvature, and then the middle back comes out, so it's a kyphotic curvature. Now, there's 7 vertebrae in the neck, we have 12 vertebrae in the middle back, and then there's 5 vertebrae in the lower back. So these are the vertebrae, guys. And then in between the vertebrae, we got the discs. Okay, so these are the discs. Okay, the disc is made out of soft jelly material. They're supposed to be the shock absorbers for the spine. Basically, this is what a normal disc looks like, guys. Down here. Okay, when there's too much pressure on the disc, what could happen is the material inside, they could bulge out, and then it's gonna look something like this red dot, guys, if you guys could see. So the top one, this is what a normal disc looks like. And then a disc bulge or a disc herniation refers to this red dot here, guys. Okay, so when you put too much pressure on the discs, they could tend to bulge out like that. Okay, it's referred as a disc herniation, a disc protrusion, a disc bulge, different terms that could describe this. It is very common for people to have disc issues. A lot of people that have disc problems tend to be asymptomatic, meaning that they don't have any pain or symptoms. But as it gets worse and worse over the years, and usually it's due to repetitive actions, a lot of people don't have proper biomechanics or proper functional movements, so they put a lot of pressure on the spine as a whole, and that could tend to swell out the disc. And then like I said, a lot of people do have it and they're asymptomatic, and as it gets worse and worse, you might start having symptoms. Now, if you guys could see, these are the nerves, okay, that come out by the side of the spine. Okay, so you guys don't see the continuation here, but from the neck, the nerves come out, they go down to the shoulder, down to the arm, all the way down to the hands and fingers. From the lower back, we have the nerves, they go down to the back of the legs, front of the legs, they go all the way down to your feet and all the way in the toes. So as the symptoms get worse for the disc herniation, you might have just local pain, or as it gets worse and worse, if you guys could see, like I was showing, the nerves pass out through the sides of the spine. So if you guys have a bulging disc, what could happen is that could press on the nerve. And then if the issue is in the neck, you might start having pain going down to the arms, into the hands and fingers. In worst cases, there could be numbness, there could be tingling, and there could also be associated weakness. And then same thing with the lower back. If there's any disc issues going on in the lower back, you could have radiating pain going down to the legs. You could have numbness, you could have tingling, and like I said, in worst cases, there could also be weakness going on as well. Does anyone have any questions about the curvature or any of the structures of the spine that I just went over? Any questions on the spine, or should we jump into some, can you tell us tips for a straight body? Yeah, I'm gonna go over that right now. How to fix posterior pelvic tilt. So if you have posterior pelvic tilt, you gotta really stretch out the muscles in there. I'm not gonna have time to talk about that today, but I'll make some videos about the anterior and posterior pelvic tilt. Let's get moving here, guys. I wanna show you guys a few things. Okay, so like I said in the beginning of the live, the curvature of the neck and the lower back is a lordotic curvature. They go in a little bit. So if I place the spine down like this, I'm gonna bring this a little bit closer so you guys can see. Okay, so let's say you have a person that's laying on their back, okay? If you guys could see, the neck and the lower back have the same curve. So there's gonna be a slight, since the lower back and neck go in, there's gonna be a little bit of a space here. Same thing with the lower back. So what happens is there needs to be proper support for the lower back and the neck, for the spine, or else what happens is if you're laying down or you're sitting, what happens is gravity pulls and then there's nothing down here to support it. So if you guys could see here, what happens is as gravity pulls on the disc, then there's pressure all over the disc. You're gonna have pressure on the muscles around, and it's gonna cause spasm. That's gonna put a lot of pressure on the disc. So one of the biggest tips I like to suggest to my patients is for 10 to 15 minutes a day, guys, what you guys wanna do, if you guys have a bolster, you guys could use one of these. If you guys don't have a bolster, what you guys could do is grab a towel. Okay, so what we're gonna do, we're gonna roll up a towel. Make sure it's not too thick when you roll the towel up. Okay, so you wanna get a rolled up towel, and then you're gonna place, what you wanna do is place one right where your lower back is, and then you wanna lay down on it. Okay, so it's gonna look something like this. Okay, and then like I said, the neck has the same curve, so you could use a towel or a bolster to do the same thing here. Okay, so now if you guys could see, all the structures are supported. There's no pressure anymore. I'm gonna bring this a little closer. So if you guys could see, this are supported properly now. Everything's supported. So this gives your spine a chance to just have it in a neutral position and take the pressure off the disc. So 10 to 15 minutes a day, guys, you guys could just, use a towel or a bolster, place it on the curvature of the back and the neck, and just kind of lay down on it and let the spine kind of do its thing in this neutral position. Any questions, guys, on what I just talked about? Okay. Another thing I want to mention is one of the biggest things I see a lot of people that have neck pain, especially when they wake up after sleeping. What happens is a lot of people place the pillow in the wrong position. Now, some people like to put the pillow under the head, which is incorrect. Okay, the whole point of the pillow is to support the neck and not the head. Okay, so whenever you're placing the pillow, make sure you're putting the pillow where the upper back meets the neck. Okay, so the pillow is supposed to go here. It's supposed to support the neck. But what happens is a lot of people don't know how to properly place the pillow. So this is where the head is, guys. Okay, so a lot of people tend to put the pillow under the head. Okay, so when you put the pillow under the head, if you see, you just made this gap even bigger. So now there's going to be more pressure. So don't put the pillow under the head when you're sleeping. If you're sleeping on your back, make sure you don't place the pillow under the head. Make sure you're placing the pillow where the upper back is. So if you're placing a pillow, make sure you put it like this. Okay, so the whole point of the pillow is to support the spine and not the head. Okay, so that's a big mistake I see a lot of people do when they're sleeping. They tend to put the pillow. So it's all about positioning. It's all about proper positioning. So make sure instead of putting the pillow under the head, you put it in where the upper back meets the neck. Any questions, guys, on what I just talked about? And then I want to jump into some stretches exercises. How do you place the pillow when you're on your side? So same thing. Again, some people when they're sleeping on their side, they put the pillow under the ear, but the same thing applies. You want to support the neck. So start the pillow where the shoulder starts, so make sure you cover the neck, okay? So if you're sleeping on your side, back here. So this is where the head is. So you don't want to place it here. You want to place where the neck and the shoulder meet. So it's going to be something like this. Okay. And then also, if you're sleeping on your side, what you want to do is place a pillow in between the knees. So that way it keeps the spine straight. Okay. So what you want to do, you're going to put the pillow here, and then you want to put a pillow between the legs, or else what happens is when you're sleeping, a lot of people tend to cross their legs. So what happens is the spine goes in this rotation. Okay, so you want to place a pillow between the legs to keep the spine completely straight. Okay, and then if you're sleeping on your back, make sure you put a pillow underneath the legs to keep the legs, to bend the knees slightly. When the legs are completely straight, that stretches out the nerves, puts a lot of pressure, so make sure you're putting a pillow underneath the knees to keep that pressure off the lower back. Any questions, guys, on whatever we just talked about? If not, then I'm gonna jump into a few stretches exercises. Are you familiar with back issues after an epidural? I can't lay flat without severe pain now. Unfortunately, with epidural injections, sometimes it could be successful, sometimes it might even cause more pain. So that, also depends on who's injecting. You gotta make sure the doctor doesn't, accidentally hit any other structures around, because that could also cause more pain. But usually with an injection, it might take a week until you feel the full effect. So if you just got the injections, just give it a little bit of time until it does its thing. Any other questions here, guys? Big fan of yours from Nepal. Thank you. Okay, so if you have no questions about the sleeping positions, about the curvatures of the spine, let's go ahead and jump in. I want to show you guys a few stretches. Going back to whatever we're talking about. So one of the biggest issues, one of the biggest reasons a lot of people have pain in their spine, in their neck, in their lower back is because a lot of people tend to slouch. Okay, so this is the proper posture, proper position of the spine that you want to be in. But a lot of people, especially now with COVID going on, a lot of people are being at home. So what happens is a lot of people tend to sit slouch like this, and then if you work sitting down a lot during the day, if you're using a computer all day, what happens is people tend to slouch like this while they're working on the computer. And if you can imagine, if you do this every day over the years, for many hours repetitively, that's gonna put a lot of pressure on the spine, and then the discs are gonna start to bulge out like the way I was talking, and then eventually you're gonna start having some pain, the referral pain and all that. So biggest thing you guys wanna work on to avoid having pain, proper posture, that's key. And then also you wanna strengthen the muscles around the core. When I say the core muscles, I'm referring to the muscles in the abdomen, the rectus abdominis, the obliques, the small muscles in the lower back, the erector spinae, and then the glutes. A lot of people have weak glute muscles, which causes the lower back to compensate for the glutes. So it puts a lot of pressure on the lower back, on the middle back. So you want to make sure you fix your posture and strengthen your core muscles so that you don't have injuries in the future. Okay, so with that being said, guys, I'm gonna go ahead and show you guys a few stretches for the neck, and then I'll try to show you guys a few stretches for the lower back. And then if you have some time left, I'll try to go ahead and answer some of your questions. I know I'm getting a lot of questions here. So if you have some time at the end, I'll try to answer everyone's questions. But meanwhile, if I don't get to your question, I do have a Q&A in my bio, so you guys can always jot it down there, and I'll try to get back and try to answer some of those questions. So let's start with the neck stretches. I actually posted a neck stretch earlier, like a couple hours ago. So that's one of the good neck stretches I like to offer to my own patients. But we're gonna talk about 3 stretches right now. First one's a general neck stretch. The second one is gonna work on the upper trap, the levator. That's the one actually I just posted on my page. And then the last one, we're gonna focus on the front of the neck, the SCM, the scalenes. So with that being said, let's go ahead and jump into the stretches. So the first thing is, anytime you're doing any type of stretches, exercises, you want to make sure you're in proper form, okay? So you want to be in a neutral position. If you're going to be stretching in a slouch position, it's better not to do it because you're going to end up hurting yourself. You're going to end up hurting another structure in the body. So make sure if you're doing any stretches, exercises, always in proper form, always in proper posture, okay? So, like I said, there's going to be 3 stretches with the neck. First one's a general stretch. You're gonna feel it in the neck, in the side of the neck, pretty much all over the neck. Second one, like I said, is gonna work on the back, and then third one's in the front. I'm gonna be stretching the right side. So first thing you wanna do is sit on a chair, okay? You wanna sit up tall, like I said. Very important to have proper posture when you're stretching. We're gonna be stretching the right side. So with my right hand, I'm gonna grab underneath the chair. From here, what you guys wanna do is slightly lean. When you lean away, you're already gonna feel a stretch. You're already gonna pull here, okay? So for the first one, what you guys wanna do, grab, lean away, and simply just bring the ear to the opposite shoulder, okay? So that's the first stretch. You're gonna feel a general stretch in the neck, okay? And then from the side, if you guys can see, I'm completely straight. Make sure you're not slouching while you're stretching. Keep everything straight. With stretches, you want to hold for 15 to 20 seconds. Make sure you breathe through the stretches. The more oxygen your muscles get, the easier it is for it to open up. And then you also want to do 3 to 5 times and do it both sides. Okay, so make sure you're not just stretching one side. Make sure you always stretch both sides. Okay. Second stretch, guys. We're always going to start from the first stretch. So as long as you guys have the first stretch, you guys can do the other ones. It's pretty simple. So again, I'm going to be doing the right side. This time I'm going to focus on the back of the neck. So this is the stretch I actually just posted on the page. So what you guys want to do with the right hand, again, grab. You could lean away from here. What you want to do, come to stretch one. So bring the ear to the opposite shoulder. From here, what we're going to do is rotate the head and then look down and outwards. Okay. So now you're going to feel the pull on the back of the neck. If you want a deeper stretch, what you could do with the opposite hand, you could place it on top of the head and gently just place it for pressure, okay? When you put the hand on top of the head, make sure you don't pull the head down. The hand is just for support, okay? Just to feel the stretch a little bit more, but you're not actually pulling the head down with the opposite hand, okay? So you just come to the stretch one, rotate the head, look down and out. You could either hold it like this or just place the other hand just for support. Okay, and again, you want to hold for 15 to 20 seconds, 3 to 5 times, and make sure you do it on both sides. Okay, and then the last one for the neck, we're going to do the front, the scalenes and the SCMs. Very important to stretch out the front of the neck, guys. The scalenes, the SCM, they attach on the first and second rib. Okay, proper way of breathing is through the diaphragm, but what happens is a lot of people tend to breathe through the chest. As I said, these muscles attach here. So imagine if you keep breathing through the chest, that's gonna tighten up all these muscles in the front, and that's gonna pull your head forward. And then the more your head goes forward, that's gonna put you in that slouch position, okay? So that's why it's very important we stretch out the front of the neck, okay? So again, we're gonna start off with the right side again. With the right hand, I'm gonna grab underneath the chair. We're gonna go ahead and lean away. You're gonna bring the ear to the opposite shoulder. This time, you're gonna look up and out, okay? So just take the head up and look outwards. So this is gonna focus on the front of the neck. You're gonna feel a nice pull here, okay? Again, with the stretch, you wanna hold it for 15, 20 seconds, breathe through the stretches, and then 3 to 5 times on both sides. And another mistake I see a lot of people do when they're doing these stretches is some people, when they're stretching, they go all the way to the end and then they start bouncing, okay? They might start bouncing, thinking that that's gonna open. So you don't wanna bounce. Ligaments are like rubber band. If you bounce on the ligament, it could actually tear, okay? So make sure, take it as far as you can. When you feel the stretch, just hold it, okay? Don't bounce on the neck or any other parts you're stretching. You want to keep it still and then just breathe through the stretch. Come back to neutral when you're done. Relax for a few seconds and then repeat. And then over time, you're gonna see that the muscles are opening up. You just can't expect to do it for like a week and then expect it to open. It's a lifelong thing. You got to just do it on a daily basis. Any questions, guys, on the neck stretches before we jump into some lower back stuff? I played football today, my quadriceps injured. Anything about the neck, guys? I know there's a lot of questions coming in. Okay, let me go over the lower back stretch and then I'll try to answer some of your specific questions. I know I'm getting a lot of questions here. So I'm gonna show you guys one stretch for the lower back. This is one of my favorite stretches. I usually show this to all my patients. Again, whenever you're stretching, you wanna keep that neutral posture, okay? Make sure you're not stretching in this slouch position. I'm gonna be stretching the right side, okay? This is a good stretch for the glutes, for the piriformis. So what we're gonna do from here, guys, I'm gonna be stretching the right side. So I'm gonna cross my right leg over my left knee. You wanna keep the bottom leg at 90 degrees. You wanna keep your whole body straight. You're gonna put a little bit of pressure on the knee, not too hard, okay? If you press down too hard, you're gonna feel the pain in the hip joint, okay? So you don't wanna push it too hard because you're gonna hurt yourself in the hip. So just gentle pressure on the knee. From here, you're gonna hinge from the hips and come forward. Just like this, while you're keeping the spine straight. You're gonna come as far as you can. When you feel the stretch, you're gonna hold it, okay? Let me show this from the side, okay? So, cross the leg, bottom leg's gonna be 90 degrees. Everything straight, okay? This is incorrect, okay? Make sure you're in that proper posture. Gentle pressure on the knee, not too hard. Slight pressure, keep everything straight. You're gonna hinge from the hips, come forward. Okay, this is where I feel the stretch. You're gonna feel a nice stretch in the side of the glutes, by the side of the leg. Okay, again, everything straight. Okay, I'm not doing this. This is incorrect. Okay, make sure you keep it straight and come. The whole spine needs to be straight. Okay, just like the neck stretches, you wanna hold for 15 to 20 seconds and then repeat 3 to 5 times on both sides. Any questions, guys, on the stretch we just went over? And I do also have this on my page. I don't know, I posted it like a few weeks ago. You guys can always check down there. Questions on the lower back stretch? Okay. If you guys don't have any questions on the lower back stretch, I'm gonna try to, I have a little bit of time. I'm gonna try to answer some of your specific questions here. I pull my hamstring, it's been almost a year and I still feel a pull when I exercise. What can I do? So you wanna start strengthening the muscles, okay? If you're having pain, it's been over a year, you wanna start strengthening your hamstring so that you're not getting repetitive micro tears in the muscles. Yin yoga is worth it. Yes, yoga is actually very beneficial. There's different types of yoga. Some types could actually cause more pain for people with disc issues. So you just want to make sure, you have a knowledgeable instructor that's showing you all the proper movements. And, if you have any type of pain, if you're taking any type of exercise classes, make sure you let the instructor know so that way they can modify some exercises so that you're not hurting yourself. But any type of exercise movement, yoga especially, is very helpful for the spine. My quadricep is injured today. I can't walk as usual. So if you hurt your quadricep today, it's gonna take a few weeks to recover. Make sure you ice it for the first couple of days and then you wanna start using heat. And then try to move it as much as you can up to your tolerance, okay? A lot of people have this thing that when they get injured, they have to rest, but it's actually the opposite. The more you move, movement cures. So the more you move, the better it is. Again, I'm not saying if you get injured, go run a marathon, but you wanna try to be as active as possible up to your tolerance. You know your body better than anyone, so try to keep in motion as much as you can up to tolerance without having any pain. I love your TikToks. What is your Insta name? My Insta account name is Prime Performance Chiropractic. I do have it on my page. If you click it, it should open up to my Instagram. What should I do to get rid of vertigo? For vertigo, there's actually specific exercises. If you Google vertigo exercises, that should pop up. You could do it. But just make sure, have you been diagnosed with vertigo, or is it something you think you have vertigo? Always make sure you have the proper diagnosis before you start, doing exercises. So it's always good to see a doctor, a physical therapist, a chiropractor, any healthcare professional. Make sure you get properly diagnosed before you start an exercise program. How to heal tennis elbow. Okay, so tennis elbow, usually pain in the outside of the elbow. So what you want to do is try to stretch out the muscles, the extensors, the wrist extensors. So there's a lot of good stretches. I do have some on my page for the tennis elbow, but just a quick one. What you want to do, take out your arm like this, and then we're gonna kind of pull it. And then same thing on the opposite side. And then what you want to do, if you have tennis elbow, what you guys could do is you could actually massage the muscles. So what you want to do is kind of, this is called pin and stretch. So you want to kind of pin down the muscles while you move the wrist up and down. That's going to kind of open up the muscles in the elbow. So that should kind of help with the tennis elbow. Piriformis syndrome, second week now, stretches or exercise. So the stretch I just went over for the lower back, that was actually a great stretch for the piriformis. It actually really helps with the piriformis syndrome. To quickly recap that, sit straight, cross the leg, keep straight, slight pressure on the knee, and then you want to come forward. Okay, so from the side like this. If you have piriformis syndrome, sciatica, this is a great stretch because it really gets that piriformis glutes on the side. So if you have piriformis syndrome, try that. That's the seated version. There's also the laying down version. I have it somewhere on my page. You guys could check it out. Any other questions here? Is gaining weight a cause of back problems? Yes, if you gain weight, obviously that's going to put more pressure on your disc, on the spine, on the muscle, so it could lead to more problems. But it's not always the case. Scoliosis, anything for strengthening. So if you have scoliosis, there's some research that suggests some yoga positions can help. Planks, side planks are great for scoliosis. Planks, side planks, any core strengthening exercises. But scoliosis is a big topic, so I'll try to cover that on a different day. Can neck pain cause dizziness? Yes. If you have neck pain, sometimes it could cause dizziness. Also, you might also have vertigo. That could also be another reason why you have dizziness. But always get proper diagnosis. Quadricep problem, I told you, should I worry? I can't really tell if you might have a tear or not in the quadricep. I would have to actually do a full exam to see that. But if you just got injured today, make sure you get it checked out. Make sure nothing's torn. In order to find out if anything's torn, you need to get an MRI. Okay. Unfortunately, X-rays they don't show. They only show the bone structure, so they don't really show the muscles, the tendons, the ligaments. So for that, you would need to get an MRI. Can herniated disc cause throbbing in both legs? Yes. So as I was saying in the beginning, when you have herniated discs in the lower back, so we do have the nerves that come from the side of the spine, as I was saying, from the lower back. They go all the way down to the legs, into the feet, and into the toes. So what happens is if you have like a disc herniation, it could press down on the nerve, and then you might have the pain, you might have soreness, stiffness in the legs. And as I said, in worst cases, there could be numbness, there could be tingling, and then in really bad scenarios, there could also be weakness and atrophy, meaning the muscles start to get smaller because, the nerve is not doing its job. Any other questions here, guys? I only have 2 more minutes left. Pain near occipital, back of the head, related to the neck, insane headache. There any help? So it sounds like you have some tension headaches going on. Try stretching out the muscles. A lot of times, because the upper trap starts from here, goes all the way down to the suboccipitals up here. So if you have tight traps, tight levators, what's going to happen is you're going to have that tension, and then you're going to start having pressure and pain in the back of the head. So those are usually referred to as tension headaches. So, you know, for that, you want to make sure you stretch out the muscles. The neck stretches I was just going over, they're really helpful. Also, the one that I just posted on my page today, that should definitely help with tension type headaches. So try stretching out the muscles around the neck. Is magnesium good to take? Yes. If you have cramping, magnesium is good. But again, make sure you get proper blood work done to see if you're deficient in magnesium before you just start taking it. But magnesium does help with muscle cramping. Also, if you're getting muscle cramps, make sure you drink a lot of water. Okay, because a lot of people tend to be dehydrated. That's why their muscles tend to cramp up. So make sure you have good water intake. Make sure you're drinking a lot of water, and then also magnesium, like, is one of the better supplements to use if you're having cramping. If my piriformis is overstretched, is it good to do the stretch anyway? If your piriformis is overstretched, you want to then strengthen it. Okay, it's not good to keep stretching it because it's going to cause instability. It's going to be too loose. So once you stretch out a muscle, once it's nice and loose, then you want to start strengthening it so that it doesn't get injured again. Okay, so make sure you're not overstretching. Make sure you want to do strengthening exercises mixed with stretches. Okay, so your exercise routine shouldn't just be stretches. You want to also strengthen the muscles so they perform their job properly, guys. Okay, so with that being said, guys, unfortunately I ran out of time today. I hope I was able to answer some people's questions. Like I said, if I missed your question, I do have the Q&A. You guys could ask me questions there. I'll try to get back on live and try to answer more questions. You guys can message me. I do get a lot of messages, so if you do message me, I'll try to get to you as soon as I can. Message me on here, on Instagram, and I hope I did answer some people's questions. With that, I hope everyone has a blessed day. Have a good weekend, everybody, and I'll see you guys soon. Take care, guys.